Good afternoon and welcome to our daily media briefing. This crisis has been hard on everybody, but especially those who have lost their job and are struggling to survive. Thankfully, our region has a strong safety net that is supported by many dedicated nonprofit organizations, such as the San Diego Food Bank. Now, tomorrow at 9 a.m. in my hometown of Chula Vista, the food bank will be hosting a drive-through emergency food and toilet paper distribution for low-income families and seniors affected by the COVID-19 virus. The food distribution will serve 1,000 vehicles starting at 9 a.m. at Southwestern College. All vehicles attending must enter from East H Street. The distribution will be contactless. What that means is all attendees must remain in their cars with windows rolled up, and the food and toilet paper will be placed directly in the trunks of their cars by volunteers that will be there. No individual or families can walk up to receive food. Those who can't drive should call the food bank for a food distribution site near their home. The distribution is on a first-come, first-served basis, and it'll go on rain or shine. Also, this will be a self-certifying food distribution where attendees must verbally certify that they meet the income guidelines for the food bank. For those guidelines, you can go to their website at sandiegofoodbank.org. The food bank is also helping in many other ways. They're very involved in a project we dubbed Operation Delivery to get food to seniors and others who may be homebound. Typically, seniors in the food bank system pick up their boxes, but many have not been able to do that. So a system was set up where a call center would be placed in the food bank's conference room where volunteers would call seniors who had missed their pickup for the month of March. The caller would ask if they needed it delivered, and if they did, the information would be passed on to a volunteer driver. They partner with Team Rubicon, a group of experienced former military service members who volunteer during emergencies, and UMCOR, or the United Methodist Committee on Relief, to package and deliver these boxes. As of Monday, April 6th, Team Rubicon reported that over a 10-day period, they had made 3,119 calls and delivered 847 boxes. These are 847 households that would have not received this important food had this system not been in place. I want to thank the Food Bank, Team Rubicon, UMCOR, and 211 San Diego for partnering on this project. A job well done. Thank you to the Food Bank, and with that, let's continue with our presentations. We'll start with Supervisor Fletcher, who will give us an update on the numbers, followed by Dr. Wilma Wooten, our Public Health Officer, who will give us the latest medical updates. Thank you.
Thank you, Chair Cox, and good afternoon. I want to start today by reiterating the points that we've made a number of previous days, is that we are going to see fluctuations in the numbers. We're going to see ups and downs, and the daily numbers do not tell us a tremendous amount, but we should prepare ourselves for both ups and downs. Today we're going to report 98 positive cases, which is our highest total in the last 5 days, which is not any more a cause for alarm than a lower total from a couple days ago is a cause for relief. The only cause we care about is the cause that is truly committed to doing the things that we know that we have to absolutely do, at least for the month of April, to truly flatten and bend the curve. When you look at areas around the country that are struggling, you see really tragic circumstances in Detroit, where you have folks who are literally dying in the hallways of hospitals due to a lack of available care. You see the challenges in Philadelphia, Louisiana, Colorado, and New York. It is important for us all to remind ourselves daily that the coronavirus is equally contagious in every single place. It is not more contagious in Italy or China or New York than it is in San Diego. In San Diego, we are not seeing those scenes play out because we moved swift, we moved early, but more so because each and every one of you out there, or a significant number of you out there, adhered to the guidance. Because of your adherence to the guidance, we are in a better position. But the moment at which we become complacent and we stop adhering to that guidance is the moment at which our trajectory changes, and we very well could be on a pathway like we see in those other jurisdictions. And so we continue to ask for your ongoing commitment as we work through these issues to remain vigilant, to remain committed, and to ensure that we will get through this. We will come out of this, we will rebuild, we will rebound, but the speed at which we can begin that process is directly impacted by the level of commitment, ongoing commitment that we have through at least through the month of April here in San Diego, and so we want to reiterate that call. I want to clarify or add on to a couple amendments to our public health order. We certainly hope that all San Diegans are adhering to the strong recommendation to have a face covering anytime they leave their house, whether that be to go to an essential service like going to a pharmacy, a medical appointment, or a grocery store, or whether that be going to an essential form of employment. We strongly encourage all San Diegans, anytime they leave their house, to have a face covering, but we have amended our public health order to include employees of a few additional businesses where it is a requirement that the employees of those have face coverings. That includes banks and public transportation employees, which include our traditional public transit entities like MTS and NCTD, along with our transportation network companies, which include rideshare companies like Uber and Lyft, taxis, and any other entity that might provide transportation to the public. So businesses that are covered now include restaurants, grocery stores, pharmacies, convenience stores, gas stations, and now banks and entities providing public transportation. This revised order will be effective Monday night at midnight. I want to just take a minute. We've been, as an entity, providing a tremendous amount of data to the public in real time. We daily strive to be transparent with what we know and provide it in as many formats as possible so that the public can be informed of the situation and circumstances that we face. I believe as a jurisdiction we are doing significantly better than perhaps any other jurisdiction in taking complex information that comes in an ever-changing format, distilling it down and sharing it as quickly as possible in as many different configurations, whether that be the data we're able to break down by race or gender or ethnicity, the data we're able to break down by city or jurisdiction, in an effort to continue to strive to provide the public with easy-to-consume information about the situation here locally in San Diego. Today, we are releasing an interactive dashboard. This dashboard takes a lot of the information that's available now and simply puts it in a little bit easier to utilize and easier to visually see format. If you go to our normal website, coronavirus-sd.com, you will see in the top left-hand corner there a blue box, Coronavirus in San Diego. If you click on that box, it takes you to the Coronavirus in San Diego landing page, and there you see in bold blue font, County of San Diego Coronavirus Dashboard. If you click on that link, it will take you to the dashboard. And what you see graphically displayed here is a configuration of our total confirmed cases. You can see reported tests, hospitalizations, and ICUs. Those are cumulative figures that are right there in the middle of the chart. On the right hand, we'll get to in a second, is some geographic breakdowns of those. And then on the left hand, you see two charts that represent total cases and new cases, along with hospitalizations, ICUs, and deaths. If you click on that top left-hand portion, you can see a blow-up portion, and this will show you the total cases cumulative, along with the new cases by date. And you can scroll along there and see the day-by-day trajectory and see where we were at each point in time in our evolution through this episode. If you go and extrapolate the bottom left chart, this chart shows you the information around hospitalizations, ICUs, and the unfortunate loss of life, again in a day-by-day chart so you can look back and see what the totals were at any day in our evolution through this endeavor. In terms of the geographic display, you have two options on the right-hand side for the geographic display. Let's take a look at the one that is by jurisdiction. So this shows the total confirmed cases by residency, and you can see that. You can click on an individual one and get a little pop-up and see a list along with the nice chart across the bottom that'll show the day-by-day trajectory for that particular jurisdiction. And then after we provided jurisdiction, we had a request for information by zip code, and you can also see and access that information here, where again you can look at a zip code and see the particular tracking. We also have in the center part of the dashboard, if you click across the bottom, you can look at a total confirmed cases by California county, and you can see where we are in relationship to other county. And I believe we are working to adjust this based on population so that you can continue to get an update there. Again, I want to reiterate a couple of the key points that the zip code data, while we want to share it in an effort to be transparent, is not particularly informative as to the true scope of what it is. It is informative as to the scope of what we are aware of. It is informative as to individuals who were able to obtain a test and the zip code where they list their residence. It doesn't mean that's where they are. It doesn't mean that's where they acquired it. And the same is true with the jurisdictional data. And then as it relates to the testing by counties, I just want to point out that San Diego County, although we continue to want more testing and we continue fighting to get more testing, recent reports have indicated we are doing more testing than any other county in San Diego County. And so our numbers relative to other counties are going to be disproportionately high just because they're not adjusted based on the availability of testing. The fact that we're doing more testing is a good thing for San Diego County and certainly something that we want to continue. Given all of that information, we're going to quickly run through our charts today. Today, as I mentioned, we reported 98 new cases to bring us to a total of 1,628. Our total number of tests in San Diego County is now approaching 23,000. We're at 22,098. And again, these get reported in batches. Here you can see the total number of tests versus total positives. We are holding steady there at about 93% of all tests are coming back negative. And then the next chart is just our positives along with our hospitalizations, our estimated recoveries, which we have covered at length. That is an estimation. ICUs and the unfortunate loss of life. We're reporting 4 additional deaths today. Our ICU bed rate is currently doubling at about every 8 days, hospitalizations doubling about every 7 days, and positives doubling about every 10 days. Again, those are encouraging numbers, but they should only encourage us to continue doing what we've been doing in an effort to make sure that the trajectory that we're on continues and does not reverse. Motel rooms, a slight uptick in public health rooms occupied and number of guests. Regional Task Force on the Homeless Rooms, we had an error in our slide yesterday, just a typographical error. We have corrected that. Yesterday's slide represented a wrong number. Today's slide represents the correct number. Outreach efforts, increases in 211 calls, nurse calls, epi calls. Hygiene kits remain the same. Slight increase in the number of hand washing stations and toilets distributed remain the same. Personal protective equipment, an increase in every category here. N95, surgical face masks, face shields, goggles, gowns, gloves, all an increase. We are approaching 2 million individual items of personal protective gear being distributed. And we continue to push to get more. We've been encouraged by the release of the state in terms of what they are expecting to come. We certainly hope that that comes soon because a number of entities are beginning to run low, and so we will continue to fight to get as much personal protective equipment as we can to fill the need for our region. Ventilators down a little bit today only because 2 of the hospitals did not report by the time we prepared today's charts. That is the end of my report, and I will now turn it over to Dr. Wooten for our Public Health Officer's report. Thank you.
Good afternoon and welcome everyone, and thank you, Supervisor Fletcher. Thank you to all San Diego residents for doing your part to stay at home unless going out for essential activities or as an essential worker. So when you leave your home, we are asking that you cover your face. Regarding global, national, state statistics, today's numbers are based on data from the Johns Hopkins dashboard this morning at approximately 10 a.m. Globally, we have approximately 1.5 million positive cases that have been reported, which includes almost 91,800 deaths. Nationwide, there were 423,579 positive cases reported, including approximately 15,800 deaths. Statewide, there have been 19,127 positive cases, which includes just over 500 deaths. Today, the County of San Diego is reporting 1,628 cases, which is 98 more cases than yesterday, and 40 deaths, which is 4 more deaths than reported yesterday. Of the 1,628 cases, the age range of these cases is from 3 months of age to 100 years of age. 858, or 53%, of the total number of cases are between the ages of 20 to 49 years of age. 790, or 48.5%, are female, 832, or 51%, are male, and 6, or approximately 0.4%, have no gender identified at this time. 348, or 21%, of the cases have been hospitalized. 132, or approximately 8% of the total number of cases, have been admitted to the ICU. ICU cases are a subset of the hospitalized cases, and this number is 38% of the total number of those hospitalized. Lastly, the 40 deaths represent 2.5% of the total number of cases. Most of the deaths for which we have data, which is 29 cases, 40% are female and 60% were male. Regarding the race and ethnicity of the number for which we have data, 16 or 55 are white, 10 or 30, almost 35% are Hispanic, 2 or 6.9% are Asian, and 1 or 3.4% is of multiple races. None of the cases or individuals that have died are African American or Black, Pacific Islanders, nor American Indians. So our sincerest sympathies and condolences once again goes out to all of the families for which we have reported deaths. As a reminder, all of our demographic information can be found on our county website, which is on the placard here in front of me. Regarding outbreaks in congregate and community settings today, we are reporting a cumulative total of 28 confirmed outbreaks. 20 outbreaks in congregate facilities represents 3 new outbreaks in this group. Collectively, this represents 183 cases and 15 deaths, and there are 8 outbreaks in community setting locations, which is unchanged over the past several days, and this represents 38 cases and 1 death. Lastly, this week is National Public Health Week, and we recognize individuals that are in the public health profession. This occurs during the first full week of April. Typically, in recognition of this annual event, the Live Well San Diego Public Health Champion Awards would be held tomorrow. This year, the event will be modified and presented virtually, with our first recipient being announced tomorrow. Today, we would like to thank all essential workers for serving our communities during this COVID-19 crisis. Thank you again, everyone. Now, please welcome back to the podium Chairman Cox. Thank you.
Thank you, Dr. Bootner. We're going to go directly to the calls, and I believe we have 4 waiting. If you would, if you're not identified by name or outlet as you're introduced, please make sure you do that and then state your question.
NBC 7, please state your name and question.
Hi, my name is Alexis. I'm with NBC 7. I'm calling with a question about what would happen to the curve if people became complacent and started going out and gathering and not wearing masks. And are you prepared, equipped to enforce that stay-at-home order?
Okay, Dr. Wooten will answer that question.
I think the answer there is quite obvious. If we loosen up the health officers' orders that have been implemented already, we will continue to see our numbers increase, maybe even exponentially, because individuals are being exposed and more individuals will be exposed and therefore test positive, and we will have greater increased number of cases as well as deaths.
Okay, next question.
Voice of San Diego, please state your name and question.
Lisa Halverstadt from Voice of San Diego. And so my question is, last month, the CDC issued guidance that homeless camps should not be broken up during this time unless there is a housing unit available for the homeless individuals living there, noting that if you make homeless people move elsewhere, it can fuel the spread of coronavirus. And I know at least the San Diego Police Department has continued to enforce illegal lodging and encroachment, which are two offenses that encourage homeless people to move along, whether they're cited, arrested, or even just warned. So I have two questions about that. One, do county health officials have any concern about this continuing enforcement? And two, has the county spoken to the city of San Diego or other local law enforcement agencies about continuing this enforcement? And if so, can you describe the nature of those conversations?
Okay, I believe Dr. Wooten will answer the first part of that question, and then Supervisor Fletcher will probably answer the second.
Thank you for that question, Lisa. Absolutely, our intent is to adhere to CDC's guidance. We recognize that while optically it may not appear to be the best situation, but transferring individuals that are in encampments in the general public into a congregate setting might not be the best thing. That's why our focus is if individuals need to be transferred for whether or not they have symptoms or for to receive services or wraparound services, there are individual hotel rooms that are available, and Supervisor Fletcher will talk additionally about those resources that are available.
I will ask though, Dr. Wooten, I am curious whether there has been a discussion about enforcement at this point with the law enforcement agencies.
There, absolutely, the Sheriff's Department has the lead on enforcement for the county, and there has been numerous conversations with the law enforcement entities. As you may be aware, Sheriff Gore was here and has been here a couple of times, as I recall, to talk about enforcement efforts.
What about with the San Diego Police Department?
I think Dr. Wooten answered the question in terms of the sheriff. If they've had conversations with San Diego PD, you would have to ask them. I think just so we know that a lot of the effort and aim around the convention center has been initially to provide physical distancing from individuals who are presently been sheltered. There are also a number of individuals that may have historically wanted shelter, but it was not available. Those would not be in the same category as those folks who are in established encampments who are shelter resistant, and provide the opportunity to them. And then I know anecdotally from a number of homeless providers, there are a increasing number of unsheltered individuals that may have been historically resistant to shelter, whose normal way of life has been disrupted, and the normal way that they survive has been disrupted. And those individuals now are seeking shelter. And so there's an effort to make sure that that is available in an environment that ensures physical distancing, that ensures access to healthcare screenings and screenings for symptoms, ensures access not only to basic food and sanitation, but also mental health and behavioral health services, and that is the aim and the intention of what everyone is trying to do jointly at the convention center. And then all of our efforts with public health nurses embedded with homeless outreach teams continue and will remain, because if you have individuals who are in encampments who are symptomatic, we certainly want to make sure that they get tested and that they have the availability of medical treatment.
Thank you.
Okay, next question.
10 News, please state your name and question.
Yes, hi, this is Steve Atkinson with 10 News. I heard Supervisor Fletcher talking about how San Diego County leads the way in testing for the state of California. We're wondering How is testing equality determined and distributed here in our county? For example, we've heard stories, not necessarily here in San Diego County, but other locations where wealthy individuals who have access to the right doctors or even transportation get those tests. So how is the county making sure the tests are available for lower income people who can't drive, especially with MTS being limited right now, or who don't have access to a doctor?
Okay, Dr. Wooten's going to answer that question.
Well, first of all, there are a number of resources available to individuals that do not have health care services. Any individual who is in the need of health care can always call 211 and be connected to an appropriate resource. Regarding testing, and I've explained on several occasions about the capacity that we have here in San Diego. First, we have our public health laboratory, and we have a capacity of about 310 tests per day, and our test results typically come back within 24 hours. We have hospitals, approximately 6 to 7 hospitals that are currently testing. That capacity per day is about 1,500 tests, and those tests come back within 1 to 5 days. And the third bucket is commercial laboratories, and there are 4 in San Diego in addition to LabCorp and Quest. We now have Mayo and BioReference, and they have to send their laboratory, their tests out of the county and in many cases out of the state, but they do have the capacity for 23,000 tests per day. And I am aware also that there, as you've heard from the governor, there are going to be testing hubs throughout the UC system. So I believe our local UC, University of California, San Diego's healthcare system is going to be involved there. Kaiser is expanding. And also, we are aware that as of today, Family Health Centers of San Diego is also standing up testing. So as we have consistently stated, testing is increasing, and while we might be testing more than any other jurisdiction in the state of California, we all know that more testing is needed, and we will work with our local health care partners to support that effort. In terms of, and I think the question was, how do you regulate who gets tested? We have a prioritized process for testing in terms of, and this is not just San Diego, this is based on CDC recommendations in terms of those individuals with underlying medical conditions, individuals with compromised immune systems, long-term care or congregate living facilities, as well as our healthcare providers and first responders. That's the list of prioritized testing. If individuals, however, no matter what category they are in, if they need to be seen and treated and tested, we will support, and that is being done across our healthcare systems. We're telling individuals, about 81% of individuals will have mild to moderate symptoms, which means they do not need to be tested. So that is our stance at this time. That's the information we have consistently given out, and we continue to follow that process. Dr. McDonald, do you have any additional comments?
Thank you, Dr. Wooten. I think it's important to understand that lab tests are ordered by physicians and by credentialed healthcare providers. And the county role is to make sure that those who are vulnerable and need access to care can get it through the mechanisms that are in place, such as 211 and other federally qualified health centers. Again, our role in the county is to make sure that those who are vulnerable get access to care and are evaluated. It's up to the providers to then make the decisions about who needs to be tested and who doesn't, based on the priorities that we have promulgated with the support of CDC guidelines.
Okay, let's go to the last phone call we have, then we'll get to the text questions.
San Diego Union Tribune, please state your name and question.
Paul Sisson. I wanted to talk about an interesting report I saw today out of Chicago regarding what they call a super spreader, someone who, for whatever reason, perhaps a large viral load in their body, infects an outsized number of other people in the community. I wonder what you can tell us about what your epidemiological investigation has found so far in terms of whether you've identified any people like this in San Diego. And also, what is the longest chain of infection that your investigation has detected so far? Do you have any people who have infected a larger than average number of people?
Dr. McDonald's going to answer that question.
I think that's a very interesting question. Other coronaviruses are known to have the phenomenon of very specific individuals who are super spreaders. I don't think it would be surprising that that would be the case here. And we don't have specific evidence in San Diego of a super spreader. We have the number of outbreaks that Dr. Wooten described that are in congregate living facilities and also in the community. And in those specific outbreaks, we don't have a specific individual that we can identify as one of these super spreaders. It is possible that that exists, and that is why we have the same advice for everyone in San Diego, which is to treat other people as if they might have the virus, and for you to treat yourself like you might be incubating if you're actually interacting with a lot of individuals. So people should stay at home, should only conduct essential business. If they're an essential worker, take precautions with social distancing in the locations that they're in. And certainly, if they develop any symptoms, immediately isolate themselves. And we hope that as testing becomes increasingly available, that they are able to get testing, even if they don't meet the current qualifications. But we, again, back to your original question, we don't have evidence in San Diego of such an individual through our current investigations.
Dr. McDonald, there is a question.
And what about the longest chain of infection that you detected so far?
Well, the chain of infection in terms of just one individual who is linked to another, who's then linked to another, that would be two links. So I don't know that we have any known investigations in which we have more than just two links, if you want to look at it that way. In terms of the number of individuals who are in any one specific cluster, our largest cluster has just over 30 patients in it, but it's a specific living facility, and it's not necessarily true that those were all from one individual. There are probably multiple links inside that chain.
How things have spread here?
I couldn't hear that question.
Oh, I just wondered how our spread compares to other communities you might have studied.
I'll have to get back to you on that. I've been really focusing on San Diego and sometimes looking at the 50,000-foot level at other locations, but I will try to answer that for you at a later date.
Dr. McDonald, I have a question for Mimi from Channel 10. With the understanding that we still can't test everyone, we don't have the capacity, when do you estimate that widespread testing will be available to the public?
Well, the answer is I don't know. I think that, again, it is clear from both the manufacturers that we've talked to, the CDC and the FDA, that more and varied testing capabilities are in the pipeline, but of course we were told that a while back, and testing wasn't as available on the ground here in San Diego as quickly as we expected or liked. So I'm cautiously optimistic that the information that we're getting, that more and more tests will become available, are in fact true. We know that some of our local laboratories have in fact increased their testing, as Dr. Wooten earlier described. And interestingly, we have another set of tests that are coming our way that we need to understand how to frankly interpret in terms of what it means for an individual patient who's been tested and what it means from counting cases. All the tests that we've had so far have been based on PCR testing, looking for the RNA of the virus that causes disease. And that is considered to be a confirmed test when we get a positive test. Many of the tests that are becoming increasingly available, and you may have heard about various locations using or various companies marketing as a rapid test, are in fact serologic tests, or tests based on antibodies. And how those tests are interpreted in terms of understanding whether this specific individual has the virus or not, and how they should be looked upon globally with the population really isn't well understood. And so I think it's going to depend on the test. It depends on whether FDA has in fact given an emergency use authorization for that test, how valid it might be. And those are questions that are really going to be answered in the next few days. We're working closely with the state viral laboratory to look at tests that are available across the state to know which ones we can rely upon as a reliable result. So when it says it's negative, it really means it's negative. And when it says it's positive, it really means it's positive. Again, if you look at the national definitions that use serologic tests to decide whether somebody might have a infection with coronavirus, the best you can do is say that it might be a probable case rather than a confirmed case. And up until now, we've only talked about confirmed cases. We may, in conjunction with the state, start reporting on probable cases in the future based on these new lab tests that become available. But that's something that we're still in discussions about. Maybe more than you wanted to know, but.
No, actually, that's great because it dips into Claudia from Univision's question. It's kind of along the same lines. Scripps announced they're using testing equipment that gives positive results in 5 minutes and negatives in 13 minutes. Do hospitals still have to send samples to county labs? Which ones don't? And how does this alleviate the issue of testing in the county?
Well, the tests that Scripps announced that they have available and operational now, as well as tests that have just become available at Kaiser, are in fact the Abbott test, which is PCR RNA based. So it is one that could be used to confidently confirm cases when the specimens are properly collected. And so we do know that those are in fact available and would become increasingly available. Our own public health lab actually tried to get those tests from Abbott and were unable to obtain those materials because of a short supply. So we're continuing to work on that. But each healthcare facility in the county is working on different strategies to be able to increase their testing capabilities. I think the supervisor mentioned that we are doing, I think, relatively well compared to a lot of other communities, but we could do better, and we expect the numbers to be increasing.
Okay, and I think there was a quick follow-up question to that. Just a clarification. Let's see. As COVID-19 tests, does the COVID-19 test graph only focus on tests done by the county lab, or does that also include private labs and hospitals?
The results that we give on our graphs actually are all results that are obtained by the county, both from our own public health lab, from our local hospital laboratories, and from commercial laboratories, the buckets that Dr. Wooten mentioned. Many of those are coming through electronic feeds that come through the state. Just had a call earlier with the state saying the number of laboratories that are in fact reporting through the state is increasing every day. So we do expect those numbers to go up. But it is really based on just what's coming in. And I will tell you that anecdotally, we still today will get results that are commercial laboratory based that sometimes are over a week old. And so the turnaround time is still an issue. That's why it's really great to hear that at least 2 of our local systems have this Abbott test, which has the rapid turnaround time, and we hope that those become more available.
All right, thank you, Dr. McDonald.
The last text question that we have is dealing with essential businesses, and Supervisor Fletcher is going to respond to that question.
This is from David from Channel 8. Can you tell me whether motels, hotels, and short-term rental businesses are considered essential? Also, some counties in California have banned short-term rentals. Is San Diego County considering doing this as well during the stay-at-home order?
Thank you, David. Hotels, motels, and even short-term rentals are okay to be operating in San Diego County if they are housing individuals related to COVID response or if they are housing essential workers. Outside of essential workers or outside of things directly tied to the COVID-19 response, like healthcare workers or our public health rooms or homeless rooms, outside of that, they should not be operating beyond those parameters. And so we don't have any immediate plans to do any more other than to provide that clear guidance and clarification of what the existing order states. Thanks.
Thank you, Supervisor Fletcher. And we do have one last question from Sarah Cohen with ABC News. And she's asking, how are you ensuring equity in testing within certain communities where access to transportation or access to care may be an issue?
So I think as was stated earlier, or it may have been inferred, we don't order tests at the county. The healthcare provider order tests. So if individuals have a healthcare provider, they have a relationship with their provider, and they can contact their provider if they need to be evaluated and be referred for testing.
Thank you, Dr. Wooten. I'm sorry, Supervisor Cox, we do have yet another question.
Okay, let's hear the question.
This is from Justina Myers from Fox 5. As we near Easter, can you please reiterate again for our viewers what is allowed and not allowed in terms of gathering with family, hunting for Easter eggs, and
Okay,
other
Supervisor
activities?
Fletcher is going to respond to that.
Thank you. As we head into the weekend, I want to address two parts. One is one that's come up surrounding religious services. The individuals at a church who might be preparing a live broadcast of that are allowable, but there are no provisions for individuals to congregate in the facility or in the building to observe in real time that participation. So if you have individuals preparing a live stream, the individuals delivering that live stream, that is okay, provided they can ensure physical distancing. In terms of what families can do, household units can participate in things in their home, in their yard, and within walking distance of their own home, whether that be Easter eggs or gatherings. We just don't want a mixing or gathering of multiple household units together. So the folks that you live with every day, you get to enjoy them for one more day and maybe do some special things on that day. But you don't get to take the other members of other households and all come together like we normally would. And, you know, we know that the things that we're going through are difficult. In our family, we have a birthday this weekend, and we're trying to arrange a Zoom birthday party and some gifts. And we know it's challenging. We know it's hard on families. We know it's hard on small businesses. But the quicker that we get through this and the more we adhere to it, the quicker that we will get out. And I think when we come out of it, the more we will appreciate those things that maybe for far too long we took for granted. So unfortunately, outside of your household unit, this is going to be a virtual weekend. And we encourage you to connect with folks outside your household unit virtually, but not physically.
Thank you, Supervisor. That concludes our calls and texts for today for the media. But like we always do, we like to wrap up with a positive story about San Diego's response to this crisis. And this one, I think, will really tug at your heartstrings. Recently, several local children showed their appreciation for the county's public health lab. Staff from the county's epidemiology and immunization service branch received handmade cards thanking them for their efforts during the COVID-19 incident. You can see these slides on the screen. They're really beautiful. I can't tell you enough how much this was appreciated by our public health lab staff, who has worked very hard nonstop during this crisis. Since the county declared a public health emergency on February 14th, our staff has tested close to 800 specimens for COVID-19 and investigated more than 1,800 persons who showed symptoms of the illness or were exposed to someone who tested positive for the novel coronavirus. And in addition to that, Their normal workload included testing for a variety of other diseases, including the avian flu, plague, norovirus, HIV, rabies, and drug-resistant tuberculosis. The lab also processes water samples, including drinking water and wastewater. I sincerely want to thank these kids and really all San Diegans for the appreciation that you've shown to our public health team. We're all in this together, and they certainly are doing an outstanding job. And so to Lena, to Isaiah, to Elissa, to Michaela, and to Maya, we thank you sincerely for those cards. I know our public health lab really, truly did appreciate them. This concludes our briefing for today. We'll be back here tomorrow at 2:30. And remember, live well, and to stay well, stay at home. Thank you.